Okay, we're here live at HMPS, the Healthcare Marketing and Physician Strategy Summit in Orlando, Florida. Lovely day in Orlando, Florida. And I'm sitting down with someone it's the first time we've met just a few moments ago. Ellen Dalton, welcome to the show.
Thank you. Thank you for having me.
You're welcome. I'm excited to talk to you because this is an interesting conversation we're gonna have. But before we jump in, share a little bit about yourself, where you work, and why you're here.
Okay. I am the Chief Growth Officer of VillageMD. VillageMD has 4 healthcare brands. We have an urgent care company called CityMD, multi-specialty companies in Connecticut, New York, and New Jersey called Summit Health and Starling Physicians. And then we have a value-based primary care company called Village Medical.
Oh, wow. So, and you're kind of over all of those divisions?
Yes.
Wow.
I am responsible for patient growth for all of those business units. And I'm here to share our story, particularly the story of how we market to and engage with older adults and our value-based primary care business, and learn a little bit too while I'm here.
Yeah, absolutely. And there is a staggering statistic you brought up. 10,000 people a day are turning 65.
That's right.
We have a very large aging population in the United States.
So shortly, 20% of the population in the United States will be over 65. 73% of the wealth in the country will be held by individuals over 55.
Wow.
Not that long ago, it was held by people who were working age. So you have all of these older people, significant wealth, but of course, just because our country is so diverse, many people over 65 struggle to afford their health care.
Oh, wow.
So it's a picture of diversity.
Yeah, it sure is. And it's a little bit different than when I entered in this industry 20 years ago. We always thought, well, the aging population, that's where, much of the specialty care is consumed. And it's true, right? I mean, we know the sicker patients are the older patients, unfortunately. But what you're talking about today is transforming the entire care experience, even to the primary care level.
Yes, absolutely. So one of the key things about all of these older adults who come into Medicare at 65, many of whom come in with one chronic condition, many will have additional chronic conditions as they age, and these conditions will not be responsible for their passing. They will live with these chronic conditions for years and years, 20 years, 30 years. So the cost to the U.S. healthcare system for keeping people stable and from keeping their disease from progressing is significant. Or I should say the cost is significant. The opportunity in order to be able to do that is really important. And that's what we're focused on, because we believe that it is best done in a primary care environment with the primary care provider as the quarterback.
It's almost like a fundamental shift in the way primary care interacts with the patient and the subsequent health system that supports it.
It is. Let me tell you a little bit about that, okay? Because we're value-based primary care, which means that we are at financial risk for hundreds of thousands of older adults. They come to us, as I said, with one or multiple chronic conditions, and we are responsible for trying to keep them out of the hospital, unless, of course, they need to be hospitalized, right? Out of the emergency departments when they panic because they can't breathe or because they've run out of medication. We are responsible for managing those people in what we call a Stay Well Care Plan.
Oh, wow.
A Stay Well Care Plan is a personalized plan of care that is intended to be experienced longitudinally, depending on your level of risk or clinical complexity. You would have a care team, could include a pharmacist, a social worker, a therapist. Sort of a broad range care team whose only focus is keeping you healthy.
That's a shift, right? Again,
yes.
Some of the things that we have to do with this industry, yet you're coming to it from a direct-to-consumer model.
Yes.
Right? Which is fascinating, because a lot of times I've worked with many traditional health systems. We see that as a threat. I almost see this as an opportunity. What is your perspective on this?
It is the way that the country will deal with this You've heard silver tsunami.
Yeah.
It is the way that the country is going to have to deal with the aging of America. We need to align incentives between payers, providers, and patients. We need to make sure we are looking at people and taking care of them longitudinally, way beyond an annual re-enrollment. And we need to make sure that acute care is there when people need it, but that it's not the default.
The handoff from primary care to, let's say, the supporting health system, though, that makes for a very interesting partnership. How do you approach that?
Yeah, well, in some markets, like in our Summit Health market, we are the primary care provider and the multi-specialty provider.
Okay.
So in some cases, it's more into the same system. In our Village medical markets, we tend to have mostly value-based primary care. So in each market, it's up to us to develop the right specialty network to refer our patients to, and to make sure that the information flows, care is coordinated, admits and discharges happen, care coordination happens, et cetera.
For those of us outside the industry, they probably are thinking, well, doesn't that always happen? But in our space, that's something almost revolutionary for us to say the data flows back and forth between these entities.
That is true.
Yeah.
Yeah.
And that's pretty profound to think about, because as we look forward, right, at the way healthcare is evolving, and even the there's more than the tsunami coming. We're facing some economic challenges. We're going to be facing a lot of different pressures on our industry, the traditional healthcare industry. I see this as being sort of an imperative for us to embrace. How do you see, like, the next few years? How are we going to navigate it? Do we need to enter into more and more partnerships like with you, or work with organizations such as yourself?
I think that a lot of organizations have dipped their toe in the water of accountable care or value-based care, and it is more difficult to succeed at than it appears. And I'm afraid some of those same organizations have retrenched, and now they're trying to figure out how to do it. Again, I believe that the country has no option. That with the sheer number of Americans who are going to be older, with the fact that 33% of them today say that they defer or delay care because of concern about the cost of care or medications, this is going to be the biggest public health problem that we have faced. So I think it's really important that the government offer these kinds of incentives, and that provider groups of all types and payers cooperate in these risk arrangements.
And embrace these arrangements.
And embrace them.
Yeah, we can't afford to walk away from value-based care.
That's right.
We have to figure out how it works. And we know we have a lot of challenges with our industry, but what you're saying makes so much sense. So let me ask you this, Ellen. Next year, when you come to this conference, what are you going to be presenting on? What's the next thing that you're looking at that should be important for us to know?
One of the things that we're working on is the way that groups of patients think about their care package. We haven't figured out how to operationalize or activate yet, but as you probably know, in the specialty care world, it can be very transactional. And we think of like a broken ankle or a hip replacement. Some things that are very separate, as if these body parts don't belong to the same person, right? So again, in this concept of sort of, birth to death care, we are working on how we think about tying those patient needs together over the long term to be able to provide the strongest care continuum that delivers the best longitudinal results. Even if you're in a commercial insurance situation where, they're just hoping nothing happens to you that year. Right.
Well, with people like you in this industry, I have faith that we're going to find our way through, and I think that's really interesting. And I look forward to talking to you next year and in the future about other things that you're doing at VillageMD to kind of help solve this problem that we're facing. So thanks so much for spending a few minutes with us, sharing some time.
You are so welcome. Thanks for having me.